I've struggled with this my whole life. Just made me so insecure. It's life-changing. Thank you, Dr. Lebowitz.
Good morning, Dr. Lebo, Gyno, and beyond. Sunday morning, Sunday fun day, of course. We got this 43-year-old gentleman from Philadelphia, Pennsylvania, who 2 years ago I did his gynecomastia. Actually, by history, he had gynecomastic gland removal only in Philadelphia maybe 4 years ago. Just gland removal, and he was unsatisfied with that, with that surgery from somebody in Philadelphia. Then he came to me 2 years ago, and this is the pre-op from what I did. You saw the flatness of the nipple, the gyno gland is gone, but he didn't like the fat and the shape of his chest, and he wanted the belly. The belly, really no minimal definition. Down below the fupa, he's got some extra skin and extra fat. So that was him 2 years ago. Side view over there again. The dramatic nature of the chest isn't great, and just definition of his abdomen wasn't up to his satisfaction. So, and this is him today. Of course, I covered the nipples because Instagram does not like nipples, and I don't want them to flag me. We did way back when we did the Vaser high definition liposculpture, the chest and the full abdomen. We did Renuvion J plasma. We did a lipo filling to the chest to make a muscle there. That's great, and he's thrilled with that. He doesn't want, he says, my chest is amazing. We did do a very mild six-pack, 2, 4, and 6, the midline linea alba, the semilunaris, the serratus muscles, the lateral oblique, down to the fupa there. But we're going to touch this up again. He wants, more than mild and moderate. He wants, kind of moderate to deep definition of his front. So we're going to redo that. No glands, no lipo filling. And also today we're going to turn him around, and he wants some sculpting of the mid and lower back. He doesn't have much fat there, really, to be fair. He's got great lats there, but he wants some skin tightening. So we're going to do the paraspinal muscles, recreate or create better the venous dimples, and create the nice gluteal muscle definition up to as I said, the lats. No fat grafting. He doesn't want any gluteal fat grafting. Stealth incision right here in between the gluteal crease. Again, in the front here. Go forward here if you don't mind. In the armpit, by the nipple, inside the belly button, and inside the groin. These front ones are the same ones we did back when 2 years ago. And he's going to be absolutely thrilled. Of course, it's being done under local anesthesia comfortably and safely. So gynecomastia Lebo, 631-424-0101, or email me at jonathanlebowitzmd@gmail.com. Let's go. Numb him. The glands are gone perfectly. See, and the scar is great. No fat grafting we did, but we're going to re-sculpt him here and even make him from mild, which he requested years ago, to more extreme definition. So there's a local little pinch. There we go. And we pump you up.
Now let us begin by introducing ourselves. I am Han. I'm France. And we want to pump you up.
And this is the local anesthesia, my friends. Everybody asks me, what are you pumping up? It's the local. Simple as that. You okay? It's a little tight. A little. Alright guys, so we numbed him up, and now we're lasering. So this is a redo. I did an amazing job the first time, but he wants, instead of mild definition, he wants moderate to intense. So we're raking up the old scar tissue here. The Vaser is melting whatever fat is left. It's also tightening up the skin, and we're going to retighten it also by doing Renuvion again. Tell me if you have any discomfort. It was tough. Redoing it. Redo the tough. But we did it. Numbing away from you. Yeah. Every once in a while, they get a little hit and run. What's up there? Just 3 minutes. We're at just over a minute. You're doing good. We're vasoring, and again, I'm redoing his six-pack. We did Miles at his request years ago, 2 years ago, a little more than 2 years ago, like almost 3 years ago. And he said, Doc, I want a little bit more. We were adding the back, and he said, let me, do it intense, or give you a really good deep six-pack. That's what we're doing. So we're taking the Vaser probe, ultrasound, and I'm really getting right underneath these transcriptions of the six-pack abdomen where the muscles are, the rectus abdominal muscle. Getting that fat really nice and pulverized. Going down to the lower belly, and we're going to do from the bottom up as well. And I can even go across here to the other side to help etch. It's a little difficult here because I did prior surgery, so he's got controlled scar tissue there. Even now go to the midline, I want to give him a deeper midline this time. What are you doing? Lipo, and etching him even more like a gladiator, doing more of a high definition. He wanted kind of moderate or mild when we first did him almost 3 years ago, about 2.5 years ago. Now as a doc, I wanted high definition. So he said, fine. And we're adding also the mid and lower back as well. No back grafting. He says my pecs look amazing. And no back grafting to his butt either. He doesn't want that. He just wants a little definition of his lower back, mid and lower back as well. I even asked him if he wanted the upper back. He goes, nope. My upper back is just perfect. So this is what we're doing. We're fine tuning him. Alrighty guys, Dr. Lebo, Gyno and Beyond, this 43-year-old gentleman from Philly who had gynecomastia surgery before me in Philly many years ago. And I just remembered he had the gland removal and he had liposuction. Now, almost 3 years ago, I did liposuction on his whole front because he was not happy with the original gynecomastia surgery and liposuction done by somebody else. So almost 3 years ago, about 2.5 years ago, I did everything. Vaser, high definition, lipo, chest, abdomen, fat grafting, and everything. He comes to me, he wants his back done now, and he said, oh, by the way, can we touch up and redo the front? At first he said I wanted mild definition, and now he said I want more dramatic. So we redid everything except for the lipo filling. We did the Vaser ultrasound, liposculpting, Renuvion J plasma, no lipo filling, and of course no gland removal because they were removed previously many years ago. We used closed drains in the most dependent. We left the belly button open for drainage. I'm covering the nipples just because Instagram doesn't like nipples, but you see the pec muscle, the lats muscle, that space between the pecs and the lats, the midline linea alba, the semilunaris, the six-pack abdomen. Now make a muscle there, 2, 4, and 6, and the V to P all the way down to the groin. We're going to be turning him around and doing his back now in a few minutes. But this is the immediate result from a touch-up of the frontal part, chest, and full abdomen. Now we're going to do the back for better definition at the patient's request. So stay tuned for part 2. The back liposculpture, Renuvion. Let's go!